The Senate has voted to move ahead on the health care legislation aimed at dismantling the Affordable Care Act. What would the new plan mean for you and your family? Here to break down the potential changes is Thomas Dunn, an insurance agent in Virginia Beach. First of all, today's action procedural. This means debate will begin. There are grim estimates that millions of Americans could lose health care coverage under this Republican proposal. Are you getting a lot of phone calls from your clients, individuals and businesses who are concerned about their health care future?
Well, most definitely, Regina. And the action they took today, I hope is a good thing, because hopefully it means they are going to actually debate something now amongst both parties. And yeah, people are calling in, mostly individuals and families. Employers with group plans aren't quite as concerned because it's not quite as detrimental to them. But when people start having their policies taken away or unaffordable or inaccessible, that's not a good thing. And what we've seen released so far doesn't produce any very positive effects on them. And we've got a lot of people, most of them who are benefiting by it are the ones who need it the most, the ones who have pre-existing conditions. And they are extremely on needles and pins right now.
There are some reports that the elderly will have a disproportionately high fee to pay for their health care coverage.
Well, that's definitely a concern too. You know, it's a very difficult problem. When they first came out with the Affordable Care Act, there was a ratio of the lowest age person's premium to a highest age person's premium, and that ratio was 5 to 1. The Affordable Care Act squeezed it down 3 to 1, and that really hurt the lower age people, especially men, who were the people that we were targeting to make this thing work. So I think they should make an adjustment in that. But any adjustment that's going to make premiums higher for the older people. Now, Medicare people aren't quite as affected as negatively as the persons that are just before Medicare ages, say 57, 58 to 64.
And part of the problem right now is the uncertainty. Chuck Schumer said today Democrats haven't even seen the proposal.
Most definitely. The uncertainty is there. We've seen it a lot in our employer group plan renewals. When the plan first came into back in 2010, we saw a reasonably good spike in insurance premium, but it was temporary for the group marketplace. Most of our groups are under 50, so they don't have a lot of negative effects of the regulatory requirements. But they quickly moderated into about 6, 7, 8% renewals over the last couple of years. This year we're back up in double digits again, and we think it's because of the uncertainty of the climate of the insurance regulations.
All right, Thomas Dunn, keep your phone handy. We may be calling you very soon to follow up on this big story.
Thank you so much.